Okay. My name is Mark Greiner. I'm going to be doing my complete head to toe assessment. I have an hour to do this, so will you please look at the clock too. Alright, so first of all I'm going to do inspection of the skin, upper extremity. Looking at her arms, making sure they're equal in size. She's got some writing on her wrist right here, but I don't see any lesions. I see some freckles. Pretty darn smooth. Skin turner. Very elastic. Checking temperature. She's got very light hair. Skin's dry. Non-diaphoretic. Okay. Also do the same with the legs. She's got her jeans on. I'm going to palpate them, make sure they're smooth, looking for lesions. You shave so you won't have any hair. Check for temperature also. And then skin turner on the tops of her feet. Nails. I'm looking to see if they adhere to the nail bed. They are painted black, so I can't check for capillary refill. A regular capillary refill is less than 3 seconds, it's normal. Go ahead and do this with your fingers. I'm checking for clubbing. You know, that hard black is kind of hard. I don't see any clubbing available or indicated. Also, we'll do capillary refill of the toes and temperature of the feet, along with the legs and everything like that. Nails. Then I'm going to go assess her, inspect her head. It is proportionally round. I see no acne. She's got a little bit of eyeliner on, but not much. Checking her hair. It looks like typical for a female. Moist, no split ends. I don't see any dander, any redness of the scalp. Is there any pain or whatsoever in your head? Okay. Okay. Also with her head, I'm going to palpate her sinuses. Any pressure there? Okay. Neck, head. I think I'll go on to the eyes next, because I can't remember anything else. Because there's no percussion, there's no escalation of the head. Next step I'm going to do is eyes. We would do a Snellen test, which checks for distance. It's done at 20 feet. We do one eye at a time with the other one covered. If she wears glasses, we check with and without the glasses or contacts, and we'd also do bilateral. She starts from the top, the biggest letter, and read her way down to the smallest line she can read, and that would be her distance rating. There's also the I can't remember. I'll say Romberg, but I think that. There's the other test which checks for near vision. She holds it at arm's length and reads the letters identical or the same as the Snellen chart, going down to the lowest one that she can see. Also, I'm going to check for peripheral vision by confrontation. Okay, so I want you to cover the same eye as I do, and let me know.
It's the same eye.
Mirror me, okay? Let me know when you see it.
See it.
Okay?
I see it.
Okay. Keep that eye covered.
I see it. I still see it. Yeah, I still see it.
Okay. And we'll do the same on the other eye. Okay. check for light reflex. I should see a little shine in each one of her eyes. Okay. Also, we're going to do cover and uncover test. So cover one of your eyes. All right. Look at the light, and then uncover your other eye. Uncover that eye. Okay. Both her eyes are in the same direction. Go ahead and do it with the other eye. Uncover. Okay. That's good. Also, I'm going to do an inspection of her eyes here. The sclera is white. Conjunctiva is pink. Moist. I don't see exudate. Eyes are blue. Not too many veins in her eyes there. Next, we're going to check your the eyes that they can constrict or dilate. Look behind me. Okay. They accommodate with extraction with the light. Focus on this. Okay, accommodating. Pupils are equal. They're round. They react to light and they accommodate. Perla. Inspect your eyelids. They cover about the upper third. Okay. Palpate her lacrimal sacs. Any pain there? Don't feel anything, no crepitus, nothing like that, no popping. Alright?
Yeah.
Okay. Also, while I'm messing with her eyes here, I'm going to check her strength for eyelids, so try to open them up. Okay. We're going to do the 6 cardinal directions of gaze. It checks cranial nerves 3, 4, and 6. So, focus on this. Okay, I did the H pattern. We're going to do the same on this side. Okay, that tested out well. I'm going to check the clarity of her lenses. Shine the light on the side. Looks clear. Don't see any scratches. Don't see any lesions, anything like that. Same thing with this eye. Okay. Then I'm going to move into her internal eye. Hold the scope here. Alright, I want you to look straight while I look into your eye. Okay. See the vessels in there? You're blinking too much. I'll be doing the same thing. See the optic disc? It's on your anterior side. Well defined, yellow in color. And then I'm going to check for the macular. Macular is where vision centered on, and then there's the fossa centralis. It's a little white spot in there that checks it's the sharpness of vision. The back of the retina is, I don't see any lesions. I don't see any hemorrhages. I'd also check the same on the other eye. You alright? Yeah. Okay. That is it for eye. I'm going to check her nose. and cranial nerve number 1. Her nose is centrally located. Now I'm going to use this one because I'm not going to put that one that's in your ears up your nose. Only got one. So I'm going to look up your nose. Got a little drainage going on. Okay. I see your septum is intact. I see the turbinates. It's moist up near the top. You don't see drainage down here at the bottom. Okay. I'm going to check for patency. Go ahead and inhale. Okay, that one's kind of plugged. That one's a little more. All right. I want you to close your eyes. We're going to check.
Oh, okay. Got it. Okay.
We're going to check for the olfactory nerve.
Oh,
Tell me what the smell is.
oh, that was something gross.
Okay. Tell me what this one is.
Monster.
Monster. The other one was hot sauce. Okay, that's her nose. We did her eyes. Then we're down to her mouth. Something gross, huh?
Crap.
While I'm on her face here, I'm going to check her sensation. Okay. Cranial nerve number 5, I think. Sensation on the face. Feel that? The ocular, submandibular. So there's three of them here. You feel all those? All right. Septal. Submandibular. Mastoid. Mastoid's the middle one. We're doing her mouth. Her lips are a little dry. No lipstick. A little chapped. Since she is sick, I'm not going to put my gloves on because she's going to gag all over me if I put anything near her mouth. So I'm going to count your mouth, or I'm going to count your teeth. Count your mouth, yep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 on the top. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 on the bottom. She's got one cavity filled in, her second last molar on her right bottom. Mucosa is moist. Let's go ahead and say ah. Alright, soft palate and the uvula move up. Back of her mouth is kind of thick. Tonsils aren't swollen. Do you still have your tonsils? Okay. Tongue is moist. There's no bumps or ridges on there. It is well defined. Go ahead and lift your tongue up. Let me see underneath. Nice, still moist. I see her frenulum. That's with her tongue there. I see her Stenson, and Warner glands. W and S, I remember that. Alright. We'd also check out her gag reflex, which is the vagus nerve. Since she's sick, I'm really not going to do that. And is it oropharyngeal? It's basically her speech, her swallow reflex is the other one we're checking. We're going to do her tongue movements, which is another cranial nerve. So go ahead and stick your tongue out. Can you curl it? All right, can you lift it, go up, go down, left and right? All right, we'll check that out. Face. Going to the ears. That. Okay. Ears, I'm going to check her occipital and her because they are articular. Sides here. Checking her ears for equal size. Her pinna should be equal with her eyes. Her right ear's folded. Left ear, it's flexible, springs back, elastic. Don't see a redness. Her ears are pierced once each ear. Okay. Get this thing on there. I grabbed the wrong ones. There we go. Checking her external ear out and her ear canal out. There's a little bit of wax, some fine hairs, what to be expected. Nothing occluding her ear. The eardrum is clear. Focal light is at 7 o'clock. What are the points in there? It's the fossa. Can't remember. Eardrum's clear. Don't see any bulges. No creamy color to it. We're going to do some hearing test. First, it's going to be the whisper test. I'm going to whisper something. Go ahead and say it back to me.
Squirrel, apple.
Okay, very good. Then we're going to do the Weber test, which is vibration on top of her head. Tell me which ear you can hear it in.
Right.
Just only in one ear? You hear it in both ears there? Okay. Normal is to hear it in both ears equally. Alright. Then we're going to do the Weber, that was the Weber test. Then we're going to do the Rhine test, which checks for bone conduction. Put it behind your ear here. Can you hear it?
Yeah.
Tell me when you can't hear it anymore.
Can't hear it.
Okay, can you still hear it?
Yeah.
Tell me if you don't hear it anymore.
Can't hear it.
Okay. We do that on both sides. Bone conduction to hearing it in the air should be 2-to-1 ratio. Hear it twice as long through the air instead of the bone conduction. That's that. Go and check her neck. Going to the lymph nodes. There is the pre-articular, articular, post-articular, occipital, any pain there? Submandibular, submental, sublingual. No problems there. The anterior chain, any problem there?
It hurts a little bit.
A little sore down there, okay. The deep ones, still sore down there?
Yeah.
The posterior,
Pulse.
a little sore there in the bottom, okay. Subclavicular down here, any pain there? A little bit, equal side or
Left side hurts.
left side hurts more? What are we doing at the time? Okay. Checking her jugulars out. Don't see any bulges. I mean, it's not any distension there. Checking your trachea, tracheus midline. Don't see both. Go ahead and do a swallow. Okay, kind of sore. Okay. From behind, for the thyroid, I'm going to push over, and then I'm going to palpate with the other hand. I shouldn't feel anything that's bulging out. Any soreness there at all?
No.
Okay. Do the same on this side. Since I'm at the neck, the jugular pulse. Go and swallow. That works. If I had a bell, I would also check for bruit. Also, when I palpate the pulses, the jugular pulses, I'm only going to do one side at a time. Otherwise, she'll pass out. All right. Also with the neck, we're going to do our range of motion and strength, okay? So we're going to flex down, we're going to extend up, we're going to tilt to your right shoulder, tilt to your left shoulder, turn to your left, turn to your right, and we're also going to do the strength here. Push, push against that, push forward, push backward. And then we're going to check, while we're here, we're going to check her cranial nerve number 11. Go ahead and shrug your shoulders. Okay? Shrug against, okay, strength's good. All right? From the back here, I'm going to check her cervical spine. Go ahead and bend over. Okay? Center line. No bulges, any pain there at all?
No.
No? Okay. All right. Then we move on to the lungs. Lungs, upper torso. We're going to look for any lesions. We're going to check the skin color out and everything like that. I'm going to palpate for any lesions, any bumps, any soreness. Nothing. Okay. Then I'm going to percuss the lung fields, bilateral. Okay, I'm going to check her thoracic expansion. I'm going to put my hands here and have her take a deep breath. Okay. While I'm back here, I'm also going to percuss her thoracic excursion, lung excursion. Anyway, take a deep breath and let it all out. Okay. I'd mark a line there. All right, take a deep breath and hold it in. And mark a line there. I do believe normal range is 5 to 7, or 7 to 9. I can't remember. 5 to 9. Anyway, that checks out how much she expands with her air. Also, I'm going to oscillate her lung fields from the back. So every time I put the stethoscope on you, take a deep breath. Any difficult breathing?
A little bit.
A little bit. Where's it hurt at? Okay. Deep breath. Okay. Also, I'm going to oscillate in the front. Bilateral. Up here. Inhale. Okay. Okay. Before we move on, tactile femurs of her back here. I'm going to put my hand on you, and you just say 99.
99, 99, 99, 99, 99.
It should be equal bilateral on the way down for vibration. If it's not, then we can inspect that even further. Heart. We are going to inspect for any well, with the lungs too. We're going to check for any thrust, any heaves. Same thing with the heart. Any visible murmurs on the outside. Seeing none. Go on to palpation. Go and check for feeling any murmurs and point of maximal intensity. My camera just died. All right. He knows what it's doing. Okay. Point of maximum intensity should be mid-clavicular, down here, fifth intercostal space, her apical pulse. That's where I should feel the most. Then I'm going to oscillate her lung or her heart sounds. First, I'm going to listen to her aortic valve, which is second intercostal space on her right side. Then the pulmonary valve, which is on the left side, same intercostal space. Third intercostal space is the Erb's point. These two up here, I'm going to hear the S2 sound. Erb's point, I should hear it pretty much equally. Fourth intercostal space, right side or left side, I should hear the tricuspid valve. And then again, mid-clavicular, fifth intercostal space, I should hear the apical pulse or the mitral valve, and the mitral valve, which is the S1 sound. I misspoke. This is S2 up here, this is S1. Okay, not hearing any murmurs, just hearing clear S1 to S2 sounds, regular rhythm. We're going to go on to the abdominal. So I need to be on your right side, so put your head up here. Okay. First of all, it's inspection. I see no venous pattern. I do see a little bit of hair around the umbilicus. The umbilicus is concaved. Equal center line. I don't see heaves, thrust, any murmurs. I do see an abrasion right there that she's itching right now. Alright. Before I palpate or percuss, I'm going to oscillate because otherwise it can disturb the vowels, make some weird sounds. So, first of all, I'm going to oscillate the 4 quadrants. Listen for intestinal sounds, any gurgling, any air. Down here in the sigmoid. I'm going to listen to the abdominal aorta. the renals, the iliac veins, and then her femorals would be down here, which are down in her pants. I'm listening over here on her left side for any organ frictional rubs. I should not hear any bruise around the in any of the arterial sounds there. Next is going to be percuss. I'm going to percuss the 4 quadrants. This should be fairly hollow, unless she's got a lot of food in her. I'm going to palpate or percuss on her left side for her spleen. It should have a hollow sound there, meaning her spleen is tucked up well in her rib cage there. Then we do her liver. Also, when we do the liver, go for the dull sound. I'd mark that. And I'd go from the top. Listen for hollow. To the dull. I'd mark that. Okay. I'd measure in between those 2 points. I don't know if I scored you enough there. And that is right at 7 meters, or 7 centimeters, which is normal. 7 meters. Alright, next thing I'm going to do that she doesn't like is the palpation. First of all, I'm going to do light palpation of the abdominal. Any pain? Then I'll do deep. No pains, no problems? Around your belly button?
Yeah.
Top? Bottom?
Top.
Top, okay. And then I'm going to also palpate her liver, which is pretty deep. There it is. Don't feel anything, any bulges. It's smooth edge. While I'm on this side, I'm going to palpate the kidney. Just take a deep breath and let it out. Okay. Smooth. Any pain there? All right. Now palpate her spleen. Kind of get underneath her rib cage. You should barely feel the ridge of it. Don't feel any bulges, any pain there. Alright, and then we're going to do her left kidney. Take a deep breath. Let it out. Tickle or pain? Alright. No bulges there. Alright, while you're still laying down here, I'm going to check leg strength, leg, hip, range of motion, and strength. So go ahead and spread your legs out. You can do one at a time. Okay. This is abduction, adduction, crisscross them. Okay. Put your foot up to your knee and push your knee out. Okay. Internal rotation. Go ahead and do it the same with the other leg. Okay. Now put your knees together and put your foot way out. This. Okay, that's external rotation. Do the same on the other side. Okay. Lift your legs straight up. Okay. Okay. Now try pushing down. Okay. Push up. Doing strength of your legs. Push up. Push down. All right. Push out. Push in. Okay. Hamstring strength and thigh strength. Okay. Also with knees, checking the joints out. I would palpate and inspect all of her joints, her elbows, her knees, all the way down, and palpate them also for any crepitus, any popping. All right, range of motion's good there. Go ahead and try to kick your foot out, straighten it out. Okay. Try to fold it up. Okay. We'll do the same thing here. Fold it up. Okay, extend it out. Okay, good there. All right, we're gonna go to your ankles, okay? Dorsiflexion, point them to your nose. All right, push them down like you're driving, okay? We're gonna do inversion and eversion. So point your toes inside, okay, and then out. All right. Then we're going to check your strength here on your feet. Push down, push up, okay. While I'm down here, things I'm with the cardiovascular, I'm checking dorsipedis pulse, post-tib, popliteal, her radial pulses, her brachial pulses, and her temporal pulses. All right. Legs. Dun, 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 dun. Can you stand up? There goes our table. Anyway, we're going to do arm, shoulders, okay? Range of motion, mind the fan, put them over your head. This is abduction, bring down and cross them across. This is abduction, keep your elbows straight. All right. Flexion, extension, hyperextension, very good. Rotate your hands in and out, shoulders, okay, internal and external rotation. Supination. External rotation is this, hands behind your head, behind your back, parade rest, okay. How are you on time? Doing good.
22 minutes.
32?
22.
22 left? Okay. While you're standing, we're going to do your strength, okay? We're going to do your elbows too. Put them out, extend them, flex them. Okay, we're going to do strength. It's going to test the shoulders and the elbows at the same time. Push out. This is your deltoids. Okay. All right. Keep me from pushing down. Okay. Okay. This is checking her biceps. Okay. And then try to extend or try to curl your elbows or bend your elbows. Okay. That's checking her triceps. Okay. We're going to do our wrist. Flex them up, extend them up, flex them down. Okay. Rotate them in and out. Very good. We'll do push up. Okay. Push down. Doing strength here. Up. Okay. Spread your fingers. Make a fist. All right. We're going to do fingers. Down. And do the base of your small finger. Very good. Grab my fingers. We're checking for strength. It's equal. Spread your fingers. I'm going to put my fingers in between there. Tighten. Okay. Try to spread your fingers. Okay, this is strength. While I'm here, I'm going to do the positional stance. Okay. Or did I do this already? I can't remember. All right. Close your eyes. Let me know if it's up, neutral, or down. Okay.
Down and up.
Okay.
Down.
Okay.
Up. Down.
Okay. While you're still standing up, I'm going to do your, go ahead and flex down. Okay. Now move up real slow. Checking your spine here for any scoliosis. Coming up equal. Don't see any bulges. Don't see any hunchback. Alright. Hyperextend back. Okay, no problem there. Bend to your right, bend to your left. Okay? Alright. While you're still standing up, we're going to do the, we call this Romberg test too, but I don't know if that's it. Okay, stand right, well, we're going to heel toe first, okay? Walk heel to toe to me. All right, turn around. Heel toe back. Check your balance, which is part of cranial nerve number 8. I'll also check it with this other test here. All right, so close your eyes. She's not swaying. Okay, we'll go ahead and open them up. With your eyes open, we're going to do the finger to nose touch. Mirror me. Okay, try it with your eyes closed. Very good, very good. All right. Go ahead and have a seat. We're going to do 2 things at once. We're going to do positional and soft. You can sense the difference between soft touch and a hard touch, which is at the end here of the Q-tip and the other end, and positional touch. So let me know if it's hard or soft, okay, the best of your ability through your genes, and point to it and tell me where I touched you, okay? So close your eyes.
Soft, left elbow.
Okay.
And right hand.
Okay.
Hard right elbow.
Okay.
Hard left footed.
Okay.
Soft right knee.
Okay.
Soft left leg.
Very good. All right. While I'm down here, I'm going to do positional sense of your toes, okay? Let me know if it's up, down, or neutral.
Down. Down. Wait, which foot?
Tell me what you feel.
Down.
Okay. Okay. I was holding your other toes and the other ones were going opposite
I
direction.
was confused.
All right, that's positional sense. Hard, soft, blah, 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 blah. All right, I'm going to move on to vibration test. I'm going to do it on our extremities. Can you feel it? Let me know when you stop feeling it. Close your eyes.
Stop.
Okay.
Stop. Stop.
Okay, very good. Don't try to look cool at it. Alright. Next, I'm going to do her reflexes. I'm going to do her tricep reflex. She has no reflexes. I'm going to do these bilateral. I'm going to do your brachial reflex. Okay. Brachioradial reflex. Okay. Again, brachioradial, brachial. Sorry. And tricep reflex. Alright. Then I'm going to do her, that was popliteal pulses I did earlier. And this is patellar reflex. Something wrong with you, darling.
You're hitting too hard.
Alright, go ahead and kneel on the table. I'm going to check her ankle reflex. I'm pounding hard. Go ahead and sit. Let me think here real quick if I missed anything. How am I doing on time?
15 minutes.
15 minutes ago. Head, eyes, ears, nose, vagus, lymph nodes, shoulders, 11, range of motion, scoliosis, hips, extension flexion, positional, reflexes, soft touch, positional, smell. Oh! Hang on. Got a problem. Last two I have to do is stereognosis. Okay, I'm gonna put something in your hand and let me know what it is.
Paperclip.
Paper clip. Okay, this hand.
Key.
Key. Okay. With your eyes still closed, I'm gonna write a number in your hand. Let me know what it is.
3.
Okay.
2.
And this is graphenosis or graphenosis. I can't pronounce it.
Was that right?
Yes, you're right. Thanks.
Oh, so wait a minute.
Positional. Got black nails. Let me test that. Soft hard touch. Let's see if there's anything else in my book. Smell, lights. That's all you think about. That's the end of my video.